Hey guys, today I want to talk to you about a common condition known as kyphosis. Now this is a term that is tossed around a lot. You'll hear it a lot in gyms as well as practitioner offices where the doctors essentially are telling you that you're kyphotic. So first I wanted to address what kyphosis is. So kyphosis is a spinal condition most commonly known as hunchback, right? And that is the most extreme case of it. In most cases, or most common cases, just people with their rounded shoulders are coming forward. So if I stand at the side, you'll see that my shoulders, they sit basically underneath my ears as I'm standing still. Now if you're kyphotic or if you have kyphosis, your shoulders will be coming forward like this, and in extreme cases you'll start to hunch your back over and then create a big bulge into the back, and the spinal cord will actually change shape. So today what I wanted to do was show you a couple exercises that are going to help stretch and strengthen that area specifically to reset the shoulder blades back and to fix that spinal, the spinal curve there. Now, you should definitely be seeing a chiropractor if you do have kyphosis. Chiropractors can help adjust the spine to manipulate it to go to straighten itself back out. If it causes a lot of pain, it's kind of expected in the beginning. But as you continue with treatment and continue with your strengthening program, the pain should reduce back down to no pain whatsoever. Now, before going over to the exercises and the stretches, I wanted to talk a little bit about what causes kyphosis. Now, two most common cases are the cause of it, basically. One is literally being hunched forward all the time and looking down. So this is stuff that's related to cell phone use, sitting at desks and computers all the time, reading books with your head down instead of holding them up at face level. All these things, what they're going to do is really start to stretch out the upper back muscles. Now when those guys are stretched out and you're not working them out and re-strengthening and repinning the shoulder blades back, they tend to weaken. Now as they weaken, of course, they don't have the strength anymore to hold and pin back the shoulders. So as a result, they do want to come forward, and then you get the hunch. Now the second most common reason is actually for tight chest muscles. Now a lot of people, especially males, they like to go to the gym and do bench press and all different kinds of exercises for the chest, and then you don't end up stretching them out. Now your shoulder, as we've talked about before in other videos, is a really big pinnacle point for your upper body structure. Lots of muscles, they come and they attach right into your humeral groove, everything like that, including your bicep, including your lats, and including your pecs as well. So it's a really important area and joint to make sure it's free and stretched out. So if your chest is overly tight and the pec tendon that does run underneath here into the humeral groove, that will cause a lot of pulling and then actually make your shoulders come forward unnaturally as well. Okay, so this exercise is called the bent over row with the scap retracted to it, okay? So I'm just gonna demonstrate, I'll show you how to do it. Now remember, when we're doing a bent over row, guys, you always wanna keep the same foot stabilizing on the ground and the same hand is pulling the weight in. My other hand is going to be flat onto the bench as well as my other knee here. Now guys, you always want to remember your hand should be faced forward, right? If you're actually pointing it inwards, you're engaging the other side of your back. So you actually want to keep it forward so that everything stays nice and neutral. So what we want to do is we're going to hold the weight here in our hand. First, you're going to let your shoulder drop. You're going to pull the scap back, and that's your scap retract part. And then we're going to go for that full row, pulling the elbow past the back. All the way down, then let your shoulder release, shoulder pins back, and then rowing all the way up again. Now what this should do is start helping and train those muscles in between the shoulder blades to hold and pin it back. Now over a course of time with strengthening, that will ultimately result in your shoulders coming all the way back and staying there for the full day and for full efforts. Okay, so now it's to stretch out your pec tendons there into the front here to help reduce some of that pulling to the front. I'm just going to use something here to stabilize your arm against. So my arm is bent at a 90-degree angle, and then I'm going to open up and then put pressure down into my shoulder. So as you can see, as I'm putting pressure down here into my shoulder, that's really getting that deep stretch into the chest. So if you don't feel it, you want to change your angles, bring your elbow up or down a little bit in order to find the right spot. Okay, so the last stretch I'm going to show you is actually to stretch out that mid-back. Now remember, because the muscles in the upper back are now weak, the kinetic transference is going to go down to that mid-back, so there's going to be a lot of tightness and tension there. So to do that, if you have a pole you can stabilize yourself with, that's great. If not, you can use a doorway where you're just actually holding onto the door. So what we want to do is we want to flip our hands invertedly, and we're just going to grab onto the surface here. Keeping the back nice and straight, we're just going to push the bum back and then let the head drop in between the arms, allowing that mid-back to stretch out. These stretches and exercises should definitely help keep the shoulder blades pinned back and give you a little bit of relief. If you're not finding any relief with pain or mobility isn't increasing, then give us a message or a call, and then we can explore some other things to do in order to help you out.